Hi, this will be the final update before I go into surgery on Monday. So if you haven't watched my other videos, you may not be aware of what's going on. So quick update. This is the bronchitis asthma thing I thought I had, which I don't have. All these years, people have been telling me, doctors have been telling me, you have bronchitis. And that's not it. Apparently all these years, I've been slowly building up to congestive heart failure, and no one's ever diagnosed it. So, watch the other videos to get the update. Here's what happened since then. Friday, a couple days ago, it would have been the 31st of January 2014. I was scheduled for an angiogram at the hospital. So I go in there and, I still have the band on, and I'll tell you why I haven't took this band off yet in a moment. So I go in there, they get the procedure going, and oh, it hurt. It hurt right here. See that? This is junk from the Band-Aid, the sticky stuff. This is the bruise. That is the blood bruise from the IV port. And I'll tell you what, let me fix my shirt. The IV port hurt. I mean, I was stuck over here a couple times in the last couple weeks for, if I can get it in there, right there. That little dot, stuck twice in a row in a week for labs. And that was no big deal. I gotta fix my shirt, that bugs me. So anyways, the first woman that stuck me, I felt no pain. That's the first time ever. Then a guy stuck me just yesterday, yeah, and that standard pinch, but this port on this arm, that was the worst. That was about maybe the worst pain of the angiogram, and however you say it. The second worst pain, or maybe the worst pain, was ripping off the tape in my thigh afterwards. And I found out the tape, it hurts when it sticks to your skin. Only on certain hairs, like right here, these hairs were more sensitive. But hairs up here for the EKG stuff, that wasn't as bad. But I left them on overnight, and I kind of like sweated them off. I can shower, but I wasn't really supposed to shower because of, hang on, the camera looks dirty. Where did I put my can? I'm going to clean off the lens. It looks dirty. Okay, I can't tell. It looks kind of dirty. It just bugs me. I'm looking at the camera. It looks like I see dust. So anyways, I could shower, but they said be careful. You can't submerge the hole in my femoral artery, which is the main vein, the big old vein in your leg that if it gets cut, you bleed out in 2 minutes or less. So, I just shower. I'm not going to submerge it. But I just don't want to mess with it. And I'm sitting around at home. I don't really smell. I'm not out exercising. So I haven't showered since Friday morning. And I peeled off, finally got all the EKG tags off, all the little sticky things. And they came off pretty easy. I thought the chest ones would be worse. They came off easier than the ones on my skin. So the bare skin hurts worse, except for like on the forearms. So the test was really easy. I was freaking out over it because things on the internet said that it would, there's complications because if you're overweight and if you have congestive heart failure, which I both have, and it was no big deal. They stuck me in the leg, little pinch, didn't feel anything else until they put the dye in. Then I got really warm, and you don't eat, and all of a sudden after the dye was in, all of a sudden felt like I was going to start throwing up. I started dry heaving, and I'm saying, I feel like I'm going to throw up. And the doctor's like, stop thinking about it. Think about something else. He was kind of funny. So I made it through that. But it went fast, and it was easy. And they put warm blankets on you. Like they microwave the blankets or put them in autoclave or something. So the blankets were nice, but they cool off. And so I was done. So they wheeled me back to the room, and I just sat there, and it sucked. I'm not a back sleeper. And it sucked because you cannot turn over. You have to lay with that leg straight for 6 hours, was it? 5 hours? And they have to check it. And then finally around 6 o'clock in the evening on Friday, they let me get up, and they had me walk around, sit back down and look. And it was fine. that healed up fine. So I'm laying there with all these things stuck in me everywhere, and not as bad as it's gonna get. So I went home Friday night. Oh, let me back up. So I'm done with my cardiologist. The heart surgeon comes in, and he's like, he comes in to tell me the results of looking at my valve and the pressure, and he says, you are in critical heart failure. So he says, you are in critical heart failure with the risk of sudden death. And he said, years ago, they would have rushed me into emergency surgery. But I guess it's changed. So anyways, he says, I want to schedule the open heart surgery for next week. And I'm like, they're all stuck there. The video just like flipped out when I did that. It like froze. That was really weird. I don't know if it's going to record like that. So he said next week. I'm like, okay. And he says, I want to do it Monday. So even though that's next week, that's like 3 days away. So yeah. So he was really cool though, and he let me drill him with 1,000,000 questions. And I went over, of course, trying to avoid surgery. Oh, you know, ripping you open. So he said the FDA is approving one that's still under study, and it's where they take the mesh stent and they put it up through the femoral artery, up all the way up, and they open it up on that valve to hold it open, make it work. Well, he said only like 1% of the people are approved, and I don't qualify. But I read online there are complications and it can fail and cause you to go back. So that's probably a good thing. A lot of it has the factor of my age because I'm only 50. And so all this started going down really fast in December when the cold snap hit and the smog came. So I thought it was the bronchitis again. And that's when my birthday is. The last day of the year. So, yeah, this was a really wonderful 50th birthday. So anyways, they said most of their patients are elderly. So anyways, that's what people in the heart place was in the cath lab was telling me. I'm not in ICU yet, so I was in the cath lab. It's just a day room. And so anyways, I went over everything with the I asked the heart surgeon a million different things. We went over biological, heart valves for pig, for cow, and mechanical. And my valve is just failing. It's aortic valve that pushes everything out to the blood and everything out to the body. So it's not closing, not opening all the way. And he said, I forget the math he told me. He told me some numbers. I was still laying in the bed recovering. I just remember him saying something like it's a 0.6 and I'm at a 0.3. 0.6 is the minimum functioning level. This is what I recall. I was kind of still coming out of being drugged. I wasn't put under, but they gave me stuff to make me sleepy and sedate me and make me not all be there. But I remember him saying something about 0.6 is the minimum, and I'm at a 0.3, and that's when he said that you're critical heart failure with risk of sudden death. So we went over the valves, and I said, okay, my goal is not to have surgery. Then number 2, my goal is to have 1 surgery, never again. So he said, okay, mechanical. He told me the name of the valve. I don't remember it. Remember, I was drugged up. I will have all this information next week. I just got my laptop up and running. I'm going to take this webcam. I mean, the laptop has a webcam, but this is the 1080p wide angle, the nice one. So I'm going to take this with the laptop to the hospital. So maybe Wednesday. I don't know, Tuesday, probably Wednesday if I'm lucky. Maybe Thursday, I don't know. Maybe ICU won't let me use it. But I want to take the laptop so I can do updates from the hospital. But we'll see what ICU says, because they're real picky about what comes in there. So, and what I can do, I'm not supposed to be lifting nothing, so they're going to have to set it up for me, put it on a table, and I can maybe type. Who knows? We'll see. Maybe I won't have any updates for a week from Monday, because I could spend 7 days in the hospital. So we go over the mechanical valve. He says the mechanical valve is designed to last 300,000 years. So I said, no, that's not good enough. I want 1,000,000 miles. No, I'm just teasing. I said, awesome, 300,000 years. That's fine. And but there's a big but. It can cause clotting. So I will have to be on blood thinners for life. And we talked about warfarin and Coumadin. He said, no, there's some newer stuff. So he told me the name. Remember, I was doped up. I ain't taking notes in the hospital. So I'll get that later when I'm out of the hospital, I'll tell you. So what he said, it's Monday morning, 5:30 a.m. I have to check in. I'm not a morning person. That sucks. So I got to be at the hospital at 5:30. I did pre-admittance when I was there on Friday, and that's when they drew some more labs. They had me wipe down and pee in a cup, and get a real sterile, a clean catch. Is what he said. So I had to do all this special stuff, wiping myself down and everything. And they had me stick these sticks up my nose. They're like Q-tips, but they're long brown sticks with the Q-tip end. And there's 2 of them on one attachment, and you have to go all the way up to here. And he's like watching me, and he's like, okay, and that's hard. This hurts up here. That goes through the opening. There's a little opening at the back. And he said, wiggle it around. It's like I'm wanting to sneeze, making you cry. And then you pull it out, and he sticks it in there to send it off. And that was, he said, mercy, I think he said. Anyways, it's bacteria that is resistant to antibiotics. So they need to find out if I'm resistant to anything so they know what to give me. So that was lots of fun. And then I had a chest x-ray and one last chest x-ray before I went in. So the next thing is I have these special instructions. I got to shower Sunday night. They said shower with my normal stuff, and I just use Dr. Bonner's. I don't use any commercial stuff with chemicals in it. And then after, I can't shave here at all, which I wasn't going to anyways. But after I shower with my stuff, then I have special soap that like kills everything. And you just do it right here on your chest. They say don't get it in your groin, don't get it in your face, cause permanent damage. I'm like, oh, yeah, that's nice. When I rinse, it's going to be headed downhill. Yeah. So Sunday night, Monday morning, I got to wash with this special soap, and they said wear clean clothes, which that's good. They told me because I'm like I'm just putting on whatever. I don't care. I'm going in for heart surgery. So anyways, Monday morning, February 3rd, I'm in the hospital having surgery. So we'll see if I make it out. This may be my, well, I'm doing a video for Zeus and Phoebe tomorrow on their channel, but this may be my last video ever. We don't know. So up to 7 days in the hospital. So it might be February 10th before I'm out. I can't lift anything. I can lift a coffee cup. Like, I don't have a glass here. You know, this little coffee cup, and that's it. You know, I can't mess around with any of the computers. I can't lift a laptop. I can't do nothing. That's for a month. So I'm off work 6 weeks, leave of absence. Second month I can lift. He told me a little bit more weight. I don't remember. And then he said the third month I can lift a little bit more, and I don't remember how much he said. I'll get that information. But that's because, you know, when you lift, these muscles come down here to your chest and they pull. That's why you build up chest muscles, because it makes you stronger. Well, if I'm lifting a heavy weight, it's going to be tearing this incision and these muscles apart, because they're going to split the sternum and cut right down the middle, split me open, and cut the heart open. And then they're going to pump all my blood on a machine, bypass the heart till they're done. Then they're going to replace the aortic valve and with a mechanical, and then I just have to recover for 3 months. And so maybe I can go to work after a month, because at work I'm sitting down at a desk, and so I don't have to lift anything major. I do take my backpack to work with bottled water and everything in it, which I can't do anymore. You know, I could carry 1 bottle of water the first month, because they gave me Dasani at the hospital, and I showed the doctor. I said, "Can I lift this the first month?" And he goes, "Yes." So, because I said I have spring water that's 16.9 ounces, that's the same as the Dasani bottle. So it's like, I don't want to eat the food in their vending machines. It's crap. They have pre-made food that's real expensive in the self-serving machines, and it's fancier than a vending machine, and you pay for it. A fancy electronic camera thing that takes your picture, but it's not good stuff. I've been going mostly raw and eating at Real Foods Market. Their soup, their cooked soup, but they make it there. They don't buy the base. They don't buy none of that crap. So I'm gonna miss that. I loaded up on some kombuchas, but I'm gonna have to have someone pre-open all the bottles, because they're usually extremely tight and under pressure. I can't do that. I haven't been doing it the last week. I've been having people at work and at home do it. So yeah, this is gonna be lots of fun. And if you watch the cat channel, Zeus and Phoebe, my cats, you know, on the other channel, because I'm putting this on Me Not Brainwashed. I'm not putting on the cat channel because those people freak out if it's not about Zeus and Phoebe. Tomorrow I'm doing a video with Zeus and Phoebe, a last video on that channel. But so Zeus and Phoebe are going to my brother's for 3 months. I bought a bunch of food on sale because I figured this was going to happen. I have a year's supply of cat litter I bought last year on Black Friday. Big 38-gallon tubs, which I can't lift now. My nephew's here, he'll take care of it. And I gave him a box of one of my greeting cards, the Zeus and Phoebe greeting cards. I put a mixture of everything with 500 envelopes. Said, "Here you go, do what you want with them." So they have a year's supply of greeting cards, probably more. Anyways, that's it. Because I get bad comments all the time and rude comments, I'm locking down the video, or locking down the comments. I have to approve them. So if you try and leave comments and they don't appear, it's because I'm not approving them, and that's because I don't have access to a computer. You know, either I'm dead, unconscious, in a coma, or I can't, or ICU won't let me use my laptop. So it could be a week before I respond and let people's comments appear. But I'm just like that. I just don't like people that are rude and mean, and if, you know, just go somewhere else. I don't want you on my channel. I don't want you giving me thumbs down. I got stalkers on my other channel that every time I put up a cat video, I get 1 or 2 or 3 thumbs down immediately. And it's like, some of these are nice videos, good videos that people love. And it's like, yeah, there's that stalker. The person's a coward. I don't know who they are. They don't come on there and say, "Hey, I gave you thumbs down," because if they did, I'd block them. You know, I block people all the time, because go somewhere else. I don't want you on my video. I don't want you in my life if you're negative. Go away. I don't need it. And there's people that just have no life, and they're on the video, and they're on YouTube going around thumbing down people. And I've gone to some of these pages when they've done that. I've looked on their page at what they do, and it's like they're visiting all these videos, and they're giving negative, rude, mean comments on all random videos. So I'm like, yeah, this person's just a hater. They hate life, and so they have to go attack other people. But I don't want to dwell on that. I want to thank you for supporting me, the channels, the Me Not Brainwash, the Zeus and Phoebe. I really appreciate all your comments, all your views. And I would just ask that you please continue to watch our videos, watch the older videos, share them all, because I'm out of work for 6 weeks. That means 0 income. I make a little bit of money on this channel. I make a lot more on the Zeus and Phoebe channel. That's youtube.com/UtahActor. It's at the bottom of this main page, the About page, just, you know, as a saying I subscribe to it. So I would appreciate if you could help us out. You know, watching the videos and sharing them are free. That's great, but I need millions of views. You know, everyone counts, but if I don't have millions of views, it's not much money. And on the Zeus and Phoebe page, on the About page, there's donation for PayPal if you want to donate. So thank you once again. Please remember, give us thumbs up, send positive thoughts. I'll read all your comments. I'll write back when I can. Thank you once again.
Oh, it's going.
Uh-huh.
How do you zoom?
You don't. It's a cheap camera. Well, there is a zoom, but it's not that good quality. Heather, do I have your permission to put your image on YouTube?
Sure.
I do?
Well, I don't think I've ever been on YouTube before.
Okay, I'll send you a
Hi,
link.
Heather.
No, thanks.
Heather, say hi to everyone.
Hi.
So Heather's the pregnant nurse, and she has to push a 320-pound man in a wheelchair.
You're only 320 now?
I lost 30 pounds with the water pills.
Wow.
And I may be down more because that was over a week ago.
Mm.
And I've been taking the water pills for 2 weeks now. So I could be below 320. I'm sure I am. So we're on to pre-admit for Monday surgery?
Yep. So her office is just an outpatient lab where we have blood drags, so.
Okay. Debo.
She's pretty fast, man.
Yeah. Well, it's I don't know where to go because this zoom.
And we're just
It
going to the left
doesn't.
right there in that open door.
We're going that way.
Okay.
That's so awesome.
Don't film anyone else.
That's the good news. The
Okay.
great news is
Sure.
they're going to make it work. Cool.
Okay.
That
Cut.
makes me feel so
No.
good. 'Cause I,
No?
So we're done with the angiogram.
That's true.
And Monday
Thank
we're
you
going
so
to have
much.
our
Happy
surgery. So we're
wedding.
doing
Congratulations.
the pre-op. And here's records of
we
my.
gotta get
This
her
is a
sticker
recording of my angiogram.
On
They said I could have one.
heart patient?
Yes.
Been
Is
waiting.
she- Oh, are you doing pre-admit tonight?
I'm doing